So to us, trauma-informed care means understanding and recognizing the impact that trauma has, and then integrating that into the services that we offer, because people experience trauma in different ways, and we need to tailor the services to what they need. Sure. At the clinic that I work at, we routinely offer specific interventions for PTSD, for example. But trauma-informed care means more than PTSD treatment. It means kind of understanding the way that the trauma has impacted any particular client, and then making sure that the services that we offer match that. So it's being able to convey to our client a sense of safety and trust in the relationship, understanding all of the different ways that trauma has impacted them, offering services that meet their needs. So not just maybe the PTSD treatment, but someone might need services for couples treatment, other groups, health interventions, vocational rehabilitation, and making sure that the client is a really active participant in that process. I think first and foremost, when we understand our client's experience, that comes through to them, and they tend to feel a greater sense of safety and trust in the relationship that they have with us, which is really important and kind of lays the foundation for all of the rest of the work that we do with them. But it also lets us kind of modify the types of services that we offer to them. For example, if a client is on an inpatient unit, and the person that they're working with notices that they seem maybe more agitated or not as responsive as usual, but there's an understanding that maybe they're being triggered by something or they're experiencing a flashback, instead of increasing their medication, maybe that person is able to offer some grounding or some emotion regulation strategies. And of course it impacts the treatments that we offer. So if somebody is coming in for substance use treatment and has tried many times to stop using drugs or stop using alcohol, but we understand that they're using drugs or alcohol to try to cope with the memories, then we can make sure that they're getting services for the underlying problem. So maybe a referral for someone to do trauma processing with them, rather than having them spinning their wheels and trying to fix something when we haven't addressed what's underneath. Well, I think that the first step is really kind of pursuing opportunities to learn more about trauma. So events like the Ivy Dunn Conference would be a great first step, and the way that that translates into the work that we do would really depend on the individual person and the context that we're in. So it could be anything from just having a greater understanding of the clientele that we work with, maybe to increasing the number of referrals or consultations that we do for trauma processing. And for some people, it might actually be being on the front lines and doing the trauma processing therapy itself. But trauma-informed care can kind of cross all of those boundaries. Well, I think one of the take-home messages that we want people to leave with is that even if the effects of trauma have been going on for a long time, that recovery is possible. So when we think about trauma-informed care and having people access the services that they need, that means that even if somebody has been experiencing the effects of trauma for a really long time, if they're able to get the proper supports, they can recover. Because even people who've been experiencing really significant symptoms are very resilient, and they can get back some of the health and well-being that they may have lost in that time period.